Speaking with IT Mate, in Indiana ranking in the bottom 5 for public health funding across the nation. Now, this comes on the heels of the state's latest epidemic, teen vaping. IT Mate's Jasmine Miner has this story.
In January, I asked legislators and the Department of Health how they plan to invest in protecting kids from vaping. But in the current budget proposal, I'm told by experts, less money than what is actually needed in public health is going to it.
The ultimate goal should be to try to keep people from ever starting this habit.
Just last month, the State House welcomed hundreds of teens working to combat the vaping crisis.
And yell out, I've got the power.
But now the budget proposal is in.
We rank in the bottom in our public health funding. We also are not funding our tobacco control program at the level that we should be doing.
The House Republicans went big on boosting public K-12 funding with $1.6 billion proposed over the next 2 years in budget. But as for public health, they're proposing an increase of funding by $255 million. That's less than half the Public Health Commission's original recommendation.
The marketing that tobacco companies they spent like $300 million in Indiana alone, and it's just absolutely insane.
It also doesn't touch how much tobacco companies spend on advertisements.
85% of youth, or I think around that amount, report using flavored e-cigarettes. So that's a big concern. We see a lot of these more heavily marketed in lower income, lower SES, lower socioeconomic status neighborhoods and areas.
Katie Hills is an assistant professor in the Department of Health Policy and Management at Indiana University. She says the state has seen an overall decrease in vaping the last 2 years, but
I think the major concerns, again, are that moving to other types of substances, moving to cigarettes, traditional cigarettes, we know are still kind of the leading type of tobacco that leads to, a ton of adverse health outcomes, cardiovascular disease, lung cancers.
She says the decrease in vaping could mean kids moving to other types of substance abuse. And the state is 8th in the nation for highest smoking rates, but 32nd for prevention and cessation funding.
I just think investing in these types of programs, investing in those efforts to address some of the underlying causes that are leading to use of these products and subsequent use of other types of products as well are important in the long run.
The budget proposal currently sits in the House. It then needs to be approved by the Senate, and a final version of the budget is expected by the end of April.
According to the Governor's Health Commission, funding isn't really the problem in the state. The issue becomes deciding where it goes. In fact, in 2019, data shows Indiana ranked 47th in funding, but just 41st overall in public health. I'm Jasmine Miner for Wish TV, IT Mate.